The whole nation knows that the health service is in deep crisis. The family doctor is harder than ever to see. Waits for hospital appointments are too often measured in years rather than days or weeks. Each year, tens of thousands of people wait more than 24 hours to be admitted to hospital from the emergency department. A spiraling crisis and a disjointed health service, which demands a solution.
But this plan postpones any meaningful shift of resources into primary or community care until the end of the plan period, around 2035. And we don't have 10 months to save NHS general practice, never mind 10 years. It's so devoid of reality, much like Mr. Streeton calling GPs IT laggards when we've been at the forefront of pioneering technology and maximising the benefits of IT in the NHS for over 30 years.
When I can't get it for my patients at the moment who have existing genetic illnesses, genetically based illnesses, there is absolutely no detail about this really worrying, really concerning proposal in the plan. It is an ethical nightmare. It is a data nightmare. We will have information in our records that would be of huge value to bad actors in the insurance industries and beyond.
We are already hemorrhaging the next generation of doctor educators, researchers, and innovators. Replacing our highly skilled medical workforce will not provide industry, patients, or colleagues of every branch of practice the confidence required to put their trust in this blueprint. Voting for this motion today acknowledges that doctors must continue to have a critical role in leading research.
This government sets out a bold vision, moving care closer to home, embedding digital innovation and tackling health inequalities. But such a vision cannot be delivered on ambition alone. Clinical leadership with consultants is critical. Consultants and all senior clinicians are the linchpin of specialist care. They carry out not only clinical expertise, but operational knowledge and the oversight of quality, safety, governance, and innovation. And the plan rightly emphasises the need for leaders.
We want the very best of this nation, for our patients, for our families, for our children. We're not just doctors, we're patients and relatives and carers too. We're not opposed or indifferent to reform. We share the goal with the Secretary of State of bringing our country's health service back from the precipice where it teeters today. We can no longer accept that it's doctors and nurses who must toil relentlessly to keep this country's health service from tipping over that edge. We need the government to step up and fulfil their promise. Today, as the voice of the medical profession, we will decide whether this plan does, in the words of the Secretary of State, have our fingerprints all over it, even if we agree with its ambition. It's no longer enough to publish a plan. The government knows it must do the hard work of making these shared goals happen. It must understand the reality on the ground. It must listen to the voices here today.